I think my perspective on healthcare was pretty limited coming in. My dad is a physician, and so I grew up going on missions trips with him, and so I got to see him do surgery and got to encounter that in developing nations and such. But I didn't really know much about the healthcare system itself. Yeah, for that matter, anything about the physician-patient relationship, something I didn't really talk about with my dad. And then coming to Baylor, I really started understanding how important it is to see the patient as a person first and then as a patient. And as someone who wants to be a clinical ethicist, I think I'll be having to do a lot with patient and physician relationships, as well as like between relationships between families and physicians and their other family members. And so understanding the dynamics of that, medical humanities has really helped me to understand that dynamic and treating the patient with the utmost respect, not just looking at them for their pathological disease or inabilities, but really looking at them as a person first with a body, soul, and spirit. And so I think that is one thing that medical humanities has really taught me. I cannot highly recommend Dr. Witt's class enough. I took Christian spirituality and healthcare with him, and that class really emphasized that portion of viewing the patient as a person first. But I think another thing that he really emphasized is that regardless of whether or not you believe in God or are religious or anything, every person is spiritual in a sense, meaning that every person encounters the question of who am I, whose am I? And I think as a physician, and anyone working in healthcare for that matter, has to understand that the patient comes from, that the patient is not just affected by their body and maybe the defects in their body or the body not working properly, but is affected by much more than that, like those deeper questions of how does the physical reality reflect their spiritual reality? And I think that's something that I thought was really important that Dr. Witt emphasized.